Hi, Dr. Keaten from Mainely Veterinary Dentistry, and you're probably wondering why I'm in the dark, but I'm here to demonstrate what we're doing when we're taking dental x-rays and how you can troubleshoot your x-rays. So when we take our x-rays for dentistry, we can't take a shot that's straight down, like straight onto the plate, just like we would for a chest or an abdomen, because we have things in the way in our mouth, like the palate, that we can't get a straight shot. So we have to do oblique x-rays to cast a shadow of the tooth onto the plate. And so you can kind of think about this like the sun, and we get a shadow of our object with the sun. So here the sun is high in the sky, we get a very short shadow of our dog that is not representative of the actual size of our dog and all the parts of our dog. And so if you get an x-ray that's very short, I like to say the tooth is standing on its head, you need to think about reducing your angle, bringing the sun lower in the sky to cast a shadow that is now more representative of the size of our object, and we get all the things of the object on there, her legs, her head, her body, right? The other way you might need to troubleshoot is if maybe your sun or your beam is too low. Then we get a very long shadow that doesn't fit on our plate. The roots of the tooth are coming off of our plate. We're not getting the whole tooth, and we're elongating our tooth, making it much bigger than it actually is. So if that happens, then we need to increase our angle and come up so that, again, our shadow is more representative of the object. So I hope that helps, but now I'm going to show you what that looks like on an x-ray plate. So now if we go to an object that's similar to our x-ray plate and shrink things down, so we have this tooth and we're pretending this is our x-ray plate, this is our beam. So if we get an x-ray that looks like this, with a beam very high up in the sky, we have a very foreshortened image. So our tooth is standing on its head, we can't see what we need to see. So when we have that, we need to think about reducing our angle, coming down with our beam, and then we get a shadow that's much more representative of our tooth. And we also have to have our tooth on the edge of the plate so we can cast that shadow of the tooth onto the plate. And then the other way that we talked about earlier, our beam might be too low, we cast a shadow that's much too long, not the same size as our image, and the shadow goes off of the plate. So that way, if we get this, we need to increase our angle and come up, and then we get a shadow that's more representative of the tooth. I hope that helps. To learn more, you can go to our website at mainlyvetdentistry.com.